Atrial fibrillation is irregular heartbeat, which is called arrhythmias, and it is type of tachyarrhythmias. Tachyarrhythmias means that heartbeat is faster than normal. Atrial fibrillation is the most common type of arrhythmia. It affects around 5% of population after the age of 65. Predominantly affects men, but complications is more common among women. And what is the most important complication, and why is atrial fibrillation so important? Because atrial fibrillation can cause stroke. And now look at the picture. When there is irregular rhythm in the atria, especially left atria, here can be pooled blood and created a blood clot. This blood clot can travel through arteries in the body and can lodge into the brain and cause stroke. So, atrial fibrillation increases risk of stroke. Person who has atrial fibrillation will have 25% risk of stroke next 10 years. So it's very important, because with atrial fibrillation and then stroke, person can die after 10 years because of stroke, and this risk is around 25%. It's very important risk, and we should focus and prevent it. Now let's say what is hallmark and how can we describe atrial fibrillation. Here you can see atrium, its upper part of the heart, and lower part of the heart is called ventricles. And here we always have electrical signals, and it creates heart rhythm, and atria and ventricles are contracted. This contraction is not chaotic in normal case, but in case of atrial fibrillation, these atrial contractions and atrial electrical signals are chaotic, irregular, and fast, and it causes fluttering of atria, irregular contractions, and regular beat is disrupted. Now let's say what is the symptoms of atrial fibrillation. In 30% of cases, no symptoms at all. And even worse, some cases, first manifestation of atrial fibrillation can be stroke. So atrial fibrillation is insidious disease, but of course in modern medicine we can more easily diagnose atrial fibrillation, because 70% of cases it has symptoms, and these symptoms are palpitations. Palpitation is when person feels arrhythmia, feels his or her own heartbeat. Normally we can't feel it, but in case of atrial fibrillation we have palpitations. Person can feel its own heartbeat, and they describe a sudden pounding, fluttering, racing sensation of heart. That's how patients describe atrial fibrillation. Now let's say what is cause. Most common cause of atrial fibrillation is hypertension. So if person has hypertension, we should suspect about atrial fibrillation, because long-term hypertension can damage heart wall, and it can disrupt electrical conduction and electrical activity of atrium, and it can cause atrial fibrillation. Other causes are heart attack. Heart attack, of course, it's heart muscle damage, and heart muscle damage, of course, can disrupt electrical activity. Heart defects, coronary heart disease, also important cause. And let's say about risk factors. What are risk factors which increase risk of atrial fibrillation? stimulants and smoking, caffeine can increase risk of atrial fibrillation. It does not mean that if you're drinking 1 or 2 cups of coffee per day, it not increases atrial fibrillation, but overconsumption of caffeine can increase this risk. Alcohol increases risk of atrial fibrillation. Pseudoephedrine increases risk, and many cough medication and cold medications also contain pseudoephedrine, which can increase risk of atrial fibrillation. Smoking is important risk factor, and sleep disorders like sleep apnea is problem, and it can increase risk of atrial fibrillation. And now diagnosis, how we diagnose atrial fibrillation. Most important is EKG, electrocardiogram, gold standard of diagnosis. And what we see on electrocardiogram, we have no P waves. What means here P wave? For example, here is QRS complex, here is T wave, and no P wave. P wave should be here, should be here, but there is no P waves. Predominantly, if there is no P waves, it usually is atrial fibrillation. Also, distance between QRS complex is not constant. Even here, you can notice that this length between QRS complex is not constant. Sometimes it's longer, sometimes it's shorter. So that's another characteristic of atrial fibrillation. And heartbeat usually more than 100 per minute. So it's tachyarrhythmia. We have fast heartbeat usually, and we have fibrillatory waves. Sometimes fibrillatory waves, here is instead of P waves we can have such thing which is called fibrillatory waves or F waves. Now let's say about treatment. In treatment, most important is to avoid stroke, prevent stroke, and reduce this heartbeat, which is important also, and correct arrhythmia. So beta blockers, calcium channel blockers, and digoxin sometimes is used. First line treatment is beta blockers and calcium channel blockers, which reduce heart rate. Antiarrhythmic drugs are used also as a first line of treatment, and if this first line of treatment is not effective, then catheter ablation is used, and anticoagulant therapy is important to prevent stroke. Anticoagulant therapy can reduce stroke by 70%, sometimes 80%. It's huge improvement and prevention of stroke, which is important complication of atrial fibrillation. That's all I wanted to say. Thank you for your interest. Thank you for your watching. If you like my videos, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.